Good morning, everybody, and welcome to the next South Island Prosperity Partnership Ideas and Impact Series. My name is Jim Hayhurst. I'm a local technology entrepreneur, investor advisor. I've also been a part of the South Island Prosperity Projects in the City's Global Fluency Advisory Group, as well as a number of other projects. And I'm really thrilled to be with you today for an encore presentation of what seemed to really hit people very well last time. And welcome back, my great friend, Dr. Myles Druckman. I'm going to give a quick introduction of Myles and then hand it over to our moderator and Myles to get going. This is exciting for me because it gives all of us in Victoria and the region, kind of a front row seat to the world's leading expert in this area. COVID-19 obviously has been dominating global headlines, local headlines, how we're dealing with it as businesses, hearing lots from the media, politicians, other leaders. And, there's probably too much information out there for us to sift through. And a lot of us are getting a little bit of fatigue that way. So having someone like Myles come and join us to talk through the global perspective and what it means for us here in the region is going to be incredibly helpful. As I said, Myles spoke with us earlier this year in the keynote preparing for the Unpreparable, talking about black swan events and whether this pandemic could be categorized as that. But through that, he shared with us some information that really blew people away, some frontline research, the work that he does. He is one of the world's foremost experts in global health security, crisis management. And to understand why he's such a sought after speaker and why we're so honored to have him here, it's probably helpful to look at his career in reverse. So today, he's the Group Medical Director for Innovation and the Regional Medical Director for the Americas at International SOS, which is the world's leading health and security services company. And I know that Carrie, our moderator, is going to ask him a little bit about what that means. Today, he's based in Los Angeles, which is obviously, it's been a hotspot. So he's had that front row seat to the pandemic, the ups and the downs. But before that, he was International SOS's point man for Beijing for 5 years. And he developed and managed their 4 global clinics, 3 alarm centers, and 26 remote site operations. And again, that'll all make sense when he actually describes what he does on a day-to-day basis. Prior to that, he spent 5 years in Moscow, where he founded the first Western medical facilities in the former Soviet Union. So he was there when the wall fell. And actually, I have here a fax that he sent on August 19th, 1991 to his friends around the world describing the fall of the wall, Gorbachev's removal, and the rise of Yeltsin. If you can imagine being there at that front line, then you understand why he's the perfect person to be walking us through what's going on now. But it was actually in the former Soviet Union where Myles and I got to know each other. We were both selected to be part of a Canadian-Soviet youth expedition to the high Arctic for 3 months in the summer of 1990, just prior to the fall of the wall and the opening of the former Soviet Union. On that trip, sea kayaking across the Arctic Ocean, rafting down the Ob River in Western Siberia, being followed by polar bears on Baffin Island, being followed by KGB agents in Moscow. We got to know each other well. And if you go to my Instagram page, you'll see a few photos of our time there, including a photo of me having just been operated on in the middle of Siberia to save my left eye by Dr. Myles Druckman. I am thrilled that he is here again. We are honored and very grateful. Carrie Slavens is the moderator for today. You know her from the South Island Prosperity Partnership, Director of Engagement, and she's the former editor of Douglas Magazine. So over to Carrie to set the stage and begin our discussion with Myles.
Great. Well, good morning, everyone, and good morning, Myles. So nice to have you back with us. As Jim mentioned, you made quite an impact at Rising Economy Week, which was back in November, and it was at a time when we didn't even know what was really going to happen with vaccines. There was so much fear and uncertainty. I know that a lot of uncertainty continues, but I know that you bring to us a global view. We're here on an island on the edge of Canada. You're looking at what the world is doing, essentially. So before we start, what I'd really like to do is, and let me just remind the audience, you will have time at the end of this for Q&A. So just put your questions into the Q&A and we will get to them, as many of them as we can. Myles, you are one of the world's foremost experts in global health security. What is global health security as opposed to healthcare?
Yeah, it's a great question, and thanks, Jim, for the very nice introduction. Yeah, global health security is the concept that health can impact ultimately the security of the world, and it really evolved over the last say 30 years with respect to pandemic, but even with Ebola outbreaks, Zika outbreaks, these types of global events that can destabilize economies. They can really crush healthcare infrastructures. They can lead to civil unrest if if you can't get care and the society breaks down. So really the challenge was, how do we as a world focus on these events that potentially can be very destabilizing, and then how do we put mitigating measures in place to try to really resolve these issues so they don't become significant security threats. So this concept of health security has been very topical, and I think we're seeing it today with the pandemic. Just how destabilizing a pandemic can be. Even in the U.S. and Canada and Western Europe, which are great healthcare infrastructures, quote civilized democracies. But the politics that we've had to deal with has been pretty destabilizing in many places too, right? So even if the healthcare system may not crumble, all of this pressure can really destabilize security. So this concept of global health security is the World Health Organization has a whole list of specific endeavors to improve surveillance so that they can see things before they happen. And then a way to help mitigate them and contain them so they don't spread all over the world. So that was really the impetus over the last 10, 15 years. And of course, this pandemic has really put a lot of pressure on some of those systems. Were they effective? How well did they work? And we're still learning all the lessons.
Right. Wow. Well, I'd like to, it's really hard in an hour to give a full scope of what you do. And Jim has given a great introduction, talked about your work in Beijing and Moscow. Now you're in LA. You wear many hats. I'd like you to talk about, give us, if you will, a day in the life of Dr. Myles Druckman.
Wow. Okay. Well, I get up in the morning. I think that look, all of us are struggling through this. I like a lot of us today, we're working from home. But operationally, within our organization, what we do is we basically support a lot of organizations in how they manage the health and security of their workforce globally. So we have, and I specifically focus on a lot of the West Coast tech companies because that's where I am today. So I would be working with some of the biggest tech companies whom you would all know, and helping them develop an agenda to support their total workforce, not just people on the West Coast, but people in India, people in Asia, people in Latin America, wherever people are. And it was interesting when you said, well, we're on a little island. I think everybody is on an island. Okay, so I think we're all on these little islands, and what the pandemic has really focused us on is that what happens in our community is very central to who we are. And so what we've learned and what we help companies do is identify that, look, you are in all these locations. How do you protect and support your people in all of these varied locations with all the different, implications of healthcare and access to healthcare and emergency services, and whether we should work from home or whether we should go to work, and if we have to go to work, how do we go to work? So on one side, we're providing a lot of advice and direction. I'll give you an example. Today, we're producing, every 2 weeks, we produce for a lot of the companies reports for all their work locations around the world, and we track how many vaccinations are going on in there. We look for opportunities where they can partner with the local government to get vaccine to their people. So we're monitoring this continuously around the world for companies. So that's one piece of it. And then, Jim talked about the health innovation side. So over the years, as I've kind of gone from disaster to disaster, maybe the disasters are following me, I don't know, or I'm causing them, I don't know. But from the different hotspots, how do we leverage technology to help organizations better visualize what's going on? And as Jim said, it's a complex world. There's so much data out there. You don't know what's real and what's not. There's so many ways you can slice and dice all this information. What's the most practical and tactical use of the data to help me make decisions? And so we've got a platform called the Enterprise Health Security Center, which basically does that for companies. So we have a lot of companies that use that, and so we maintain and run that. And then our company also focuses a lot on travel. So the question is, how do we help people make travel decisions and use data and information? And the advantage we have is that we actually have boots on the ground in 90 countries. So we actually have people physically there. So I can call up our doctor, in Bogota and say what's going on, on the ground, and they can give us real time kind of intelligence. And that's very useful, for organizations. But we also support governments as well. We do a lot of work with governments, and we work with a lot of Canadian companies and Canadian organizations. So part of my work is on the technology side and helping, innovate and continue that process, as well as supporting a lot of our global clients on their global health programs. And when it comes to and then I do some speaking like I'm doing now, and we do some thought leadership on what's going to happen in the future. We become, crystal ball, prognosticators, and that's a tricky piece when it comes to health, because, health is a science and we follow the science, but unfortunately from organizations, they can't wait for science. Sometimes they've got to say, what's our best guess today based on limited information? And so we help kind of digest that. And we have a lot of medical advisors around the world that help companies kind of take complex information and try to keep it simple.
And we talked before about how business moves according to forecasts, speed, results. Science moves according to doing good research, actually getting answers that matter. And the two worlds have been very, I guess there's been a divide between them, but this pandemic is really seeing each find advantages in the other and learning from the other. Is that correct?
Absolutely. I think what this pandemic has taught, once it's all written, I think you're going to see a couple interesting adjustments to the way people look at these types of events. First of all, there's been a lot of data coming out just recently that employees look to their businesses as the most trusted source of information. So it's no longer government, it's no longer listening to media, they're actually listening to their company first, which is a real shift, for a lot of organizations. And it puts a lot of pressure on organizations because they want to be right, right? So they want to, how do I get good intelligence? And I think you're absolutely right. Business is run based on budgets. People typically don't make their budget. Sometimes they do. Maybe they're better than their budget, but it's an estimate of where we think the future is going to be. And security directors who've been dealing with a lot of these crises, they deal with probability. So they don't know for certain what's going to happen, but is it a really good chance? And if it is, we've got to plan for that. And as you say, on the health side, on the science side, we wait for all the research to come in. You can't rush it. It's got to, be all buttoned up. But there's that gap, right? There's that gap in time between the research and what you need to do. And so we try to help guide clients based on that. I'm kind of struck by a security director last week, was saying that, if you asked all of my security analysts that were monitoring threats all over the world, in February of 2020, when this new virus started out, and they were monitoring, news reports from Hong Kong and from China about people getting sick in restaurants and in the same apartment building with the airflow. And they said, look, you would have asked, our guys would say, look, there's a very high probability that this is an airborne disease. And with that, we need to have masks, right? And so they had already made that determination before the government even announced a pandemic. So I think, the private sector has been, a couple steps ahead, but they've had to be, because they have to make decisions of what a lot of the authorities have finally, scientifically validated. And I think that's the nature of a fast-moving pandemic, is that we have a lot of unknowns, and we've got to make our best guess, and then we adjust and adapt. And businesses are very good at adapting. If they don't adapt, they die, right? So you've got to adjust to what the situation is. And masks are good now. Are they still going to be good? Vaccinations, how does it affect what we're going to do? All these new things come into play. So it's very dynamic. And so really that's kind of where the space where we kind of help out is try to make sense of all that.
Love that. And now I've heard that certain companies are kind of leaders that other companies look to for signaling strategies. For example, we were talking about the Apple stores. Can you talk a little bit about that? Who's leading?
Yeah, well, look, I think if you ask a lot of your people on the call that were running businesses, one of the key things that they always look at is benchmarking, right? Everyone wants to know kind of what everyone else is doing. They're looking left, looking right. A lot of people don't necessarily want to be right out front and take the heat, but they don't want to be at the end, looking bad. So they want to be in that nice sweet spot, kind of knowing where they are. And so because we work with 80% of the Fortune 500 companies, and you've got thousands of clients, we can kind of help also just give them benchmarking information. We can say, look, these are some of the data points that certain groups are doing, and we can consolidate that data. But yeah, Apple's been a leader. There's been a number of companies that have played a real leadership role, and I know that a lot of companies look to see in their communities, is the Apple store open? If it's open, okay, then maybe we should be open. If it's closed, maybe we should consider closing it. So there's certain signposts that they were following related to other organizations. But there's variability. Google's made a decision a year ago when they were going to go back to work. Salesforce just went back to work yesterday. So each of them kind of have their own style. And I think that's the other piece that's really important, is that a lot of organizations, I think, made the assumption that we'll just follow the CDC guidelines. We'll just follow our community, guidance from my public health. And we saw that kind of politics, and particularly in the US, has overwhelmed some of the decision making. And so companies are deciding, we're going to tell you when we're going to open. No one's going to tell us when to open. We're going to do it the right way. I mean, if you think about the happiest place in the world, Disney World, right? Florida said, no masks, everyone can go everywhere. And you said, look, you're coming into Disney World, you're wearing a mask. So each business is going to look at this as it relates to, how do I protect my customers? How do I protect my staff? How do I keep my business running? And what do I do? How do I best protect the community? And because a lot of companies, we forget how large these companies are, hundreds of thousands of employees, right? They're almost like little countries. And so they're very, very concerned about their, citizenry. And it has an impact on the community that they're in.
Exactly. Well, we're going to come back and talk a bit more about business, but first I would like you to put on that thought leadership hat, that dreaded crystal ball. And I'd like to look about, COVID certainly raised our consciousness about global threats. We're all thinking a lot more globally now. What is your assessment about where we are globally? Are we getting a handle on this? Are we moving in the right direction? Which parts of the world? We're very fortunate here in the Western world, but not everybody's been so fortunate.
Yeah, no, look, I think that, in some ways, from a global perspective, we've been a little lucky because, the outbreaks have typically been in countries that had the strongest healthcare systems, had the most sophisticated, processes to protect people. I'm thinking kind of Western Europe and North America. But my big concern is that while, we have a, we have a luxury of being concerned about trying to get people over the line to vaccinate, right? This whole hesitancy thing is a first world problem. It's most of the world is still struggling to even get enough vaccines to their population. Most of the world, doesn't have the vaccine yet. And when you have a community that is not immune to this virus, it's like fresh kindling out there. And so just one trip of one person coming to that country, and you can have an explosion. And it's a little bit like what we saw in India, where you've got a fairly, dense population mix, and limited healthcare infrastructure to the population, and the system can get very overwhelmed very quickly. So if you think of, what could happen if this was in Bangladesh, if this was in Pakistan, if this was in Nigeria, if this was in Sudan, you start to say, my gosh, how would they be able to respond? So my fear is that, we're not over until every corner of the world is out of this. So, and this does impact, global organizations and even us. If we want to travel anywhere, we're going to be thinking, what's it like in that place? And while the vaccine has been a spectacular success, particularly mRNA vaccines, when they say it's 95% effective, which is amazing, it still means 5% it's not, which means you're going to have cases. So it's not a perfect solution. It's still a great, sheet of armor for everybody. But it's going to probably wear off, and we're going to have to get, booster shots. So we're not out of the woods. And I think that, communities that have been hit hard, and you talked about me being in LA here. I think LA had a major outbreak, as we all know, California too, but it's really subsided now. So the combination of a lot of people have recovered and they're immune, and 60% vaccination rates, that's a really, I think that's the recipe for success for a potential next wave. Because if the virus comes again into LA, you're going to have a lot of people that are vaccinated, plus a lot of people that have natural immunity. So the virus isn't going to have a lot of places to go.
Right.
So that's kind of where we want to get to. We want every community to kind of have that level of overall immunity, but we are a long way from getting there.
But it's very interesting. We've been talking a lot about herd immunity and whatnot. The Washington Post recently asked an important question I'll put to you. Why is Seychelles, the world's most vaccinated country, seeing an unprecedented spike in coronavirus cases? I know much of the world wants that answer. What's your perspective on that? What do you know?
Yeah, no, we've been following the Seychelles, also Chile. So the Seychelles in particular, as you know, it's a small island country. They've had two main vaccinations. They had the Chinese Sinopharm vaccine and AstraZeneca. The Sinopharm, the data there is looking at 60% effectiveness. So what that means, the corollary is 40% not effective. So some of the initial information coming out of the Seychelles is that a third of the patients were vaccinated that ended up becoming sick or positive. So there's breakthrough there. But that is, I would say, par for the course. If you've got a vaccine that's 50 to 60% effective, you're going to have the people that are vaccinated are going to have symptoms. The key thing, though, is how many people are ending up in the ICU and how many people are dying. And so I think we are seeing, and I haven't checked the data in the last 2 days, but much lower, hospitalization rates and fatality rates. And I think that's probably related to the vaccination. So even if you are in a community that's vaccinated, you have that risk, right? They had 60% of their people vaccinated. It still means 40% doesn't. That's a lot of people to move around with. And I think the challenge with, particularly with areas with lots of, where tourism is a main source of income, you're going to have the mixing problem of lots of people coming in from all over the world. And that's going to be another risk for places like that. Trinidad and Tobago is having a big outbreak right now. And so those communities, don't have big healthcare structures. So I think, when it all shakes out, it's going to show that, yes, there was a major outbreak, but the vaccines played an important role in saving lives and reducing the stress on the healthcare system, even though it's a major outbreak. So it's a good lesson for all of us that the vaccine is not a panacea. We still have to really kind of watch things very, very carefully.
So where is Canada ranking in all of this? How are we doing from your perspective with the vaccine rollout? I mean, there's obviously always criticism, and now we just heard on the news this morning that some people in Manitoba and Saskatchewan have been going across the border, and some of the First Nations in the US have been offering up their extra vaccinations to Canadians. So how are you looking at Canada, and what is your perspective?
Yeah, look, well, as you know, I'm Canadian as well, so and my family's all there, so watching it very closely. Look, Canada from the start was one of the leaders in engaging in the vaccine procurement process. So even with Moderna, they were one of the first investors in Moderna way back when. And if you remember how the whole process worked, is that governments basically were funding the development of these vaccines, assuming if they're going to work or not. And so what Canada did is they placed their bets on multiple vaccines because you didn't know which ones are going to work and which ones are going to fail. And so they were actually, they had funded more at a higher dollar amount per capita than anyone in the world, which is exactly I think the right process. The challenge is you got to wait for the producer to actually give you the vaccine. So that was the real challenge with the Canadian government, is that you had Pfizer, you had Moderna, you had AstraZeneca, and they're producing typically out of Europe, and they have a long list of countries that they're sending their supplies to, and then they had supply problems, they had production difficulties, then they expanded their production. So for a lot of reasons, the content didn't get to Canada faster than others. But I kept saying to everybody, look, it's going to come. And when it comes, it's going to come in a big, fury. And I think now we're really starting to see a lot of supply come into the country. And even though it came in fits and starts, you could see the ramp up in Canada is much steeper. And I call this kind of the urgency period. So we saw this in Israel, we're seeing it in the US, where all the priority groups and then everyone who wants to get it, pushes to get it, but then it flattens out where now you're getting to the hesitant people, and how do we get the hesitant people over the line? So I think Canada, I would say the challenge that they had with AstraZeneca is the messaging wasn't ideal. The real concern there is a very unique population and very, very low risk of those side effects compared to the life-saving capabilities of the vaccine. So that took a lot of, made people a lot more anxious than they probably needed to be. And I think that, I think the good news is, and the other strategy too in Canada was, let's get one shot in everybody's arm, and then when the supply comes in, we'll get the second shot. So that was also, I think, the right public health strategy. But the messaging is hard when you only get one shot and I'm not fully vaccinated, I got to wait 4 months. What's going on here? So it was a really tricky situation, for the authorities to kind of manage and communicate. But I suspect that over the next month and 2 months, you're going to see a lot of those people that had the 4-month window. They might be calling them back to bring them in earlier as the supply comes in. So at the end of the day, I think Canada is going to be perfectly fine in the next month or so. They'll probably, as be a couple months behind the US, but they're still ahead of most of Europe. So if you compare it on a global scale, Canada is actually doing really quite well.
It's really interesting because, of course, we watch the US so closely, and the word smug isn't quite right, but I think we were shocked at what happened with the virus in the US and the ramp up to it, and frightened by that. And then when we saw them getting vaccinated at incredible rates, and now not having to wear masks in some places, I think we got concerned about what was happening here and maybe a bit jealous as well. But really, the US has a lot more population than us. I'm sure there's a lot of factors at play in the way they got the vaccines. Is that correct?
Yeah, look, I think the size of the US we kind of forget. So I'm in LA County, and LA County has 10.5 million people. The county, not California. So you're just talking about huge numbers, right? And so it's almost like a country into itself. It's half the size of Australia. It's in California is over 40 million. So California is bigger than Canada. So the numbers are just so big. And they really focused on just getting those vaccines out there aggressively. In the US, it was an absolute nightmare trying to sort out how it works, because it was all delivered county by county, and websites were different, and scheduling was all over the place, and you could get it here but then you can't get it there. But they got their arms around it. They had Dodger Stadium vaccinating thousands of people. So they made it work. And we're adapting, right? And that's the key thing, is they the US is very adaptable from that perspective. And it's to the point now where most of the states they have enough supply, and it's really trying to get those, as they say, hesitant people. And it's the point now where some of the states are saying, don't ship me anymore. And you're seeing the American government now shipping their excess overseas. So I think Canada will be in that position fairly soon. But I do know that the whole issue of going across the border to get your shot is very topical today. And then coming back when you have your shot, are you going to have to quarantine again? Are you going to show the little CDC card? Is that going to be good enough? So there's so many unknowns around practically how all this is going to work out. And I think we're just going to have to see as we move along.
I want to ask you in a minute about vaccine passports and whatnot. But before we do, one of the things the pandemic has really highlighted, and you touched on, is the fact that not all governments have sought to protect their citizens as well as, say, Canada. There's the messy little problem of national sovereignty. So how in a global economy where people travel and viruses travel with them, do we approach health security on a global scale, especially as confidence in institutions like the World Health Organization has, waxed and waned and whatnot? How do we begin to look at this? Do we need a new structure globally?
Yeah, I think look, there's going to be a lot of soul searching, within the WHO and other health institutions. I think we overestimate our public health infrastructure around the world. And we saw this, even with the H1N1 pandemic. In the US, the average public health county's public health organization has 18 staff, right? So it's probably one of the most poorly funded healthcare infrastructures around the world. Usually, if you go to most countries, public health is way down the list of getting the best doctors, getting the best nurses. So it's not something that's been typically highly prioritized. And so that's been, that's the nature of it. And also, places like the CDC and the WHO, they don't have an army of people, scouring the world all the time, right? So they have limited capabilities too. And it's just par for the course. So I think we need to find a better private-public partnership to better gather information and intelligence, and then be able to make actionable decisions about it. And I think that's part of the challenge, with the WHO. It's also, very political. It's also underfunded, and it doesn't have a lot of teeth too, as well. So, but you need a global organization. So it's a question of, you can't just, if you throw it out, you'd have to build another one. And so I think the question is, what does the new global health infrastructure look like? How do we collaborate? If we knew about, Wuhan 2 months earlier, would have it changed the outcome of this pandemic? So we're doing some advanced, work with some of the big tech analytics groups on trying to create kind of the next generation, global surveillance platform, looking at a lot of the key indicators that might have been, that we could have picked up, in the fall of 2019 instead of, in the winter of 2020. And then the question is, would that change the outcome? And what do we need to do better try to change the outcome. And I think the US is a classic example of a government that and a community that is very individualistic in our view, right? As opposed to some place like Singapore, which is very community in their view, right? And so you have those strengths and weaknesses which affect public health. Enforcement, having citizens do the right thing, you can potentially stop an outbreak that way. If they won't do the right thing, you're going to have the risk. And so I think the US probably, we're going to look back and say, if we probably were more aggressive, we might have been able to nip it in the bud. But it's a hard call because, as we all know, it's been a painful process to be locked down. I mean, you guys are going through it again. Everyone's exhausted. You lose your discipline, and then something bad happens again, and you're back where you started. So it's a tough decision.
So when we had you here last time, we talked about this pandemic as a black swan event, how to expect the unexpected. I think there's general agreement that this is probably not going to be the last pandemic we're going to have. We have threats of global warming also on public health, public health. So what have we learned from this that we need to know going forward into the future, so we're better prepared next time?
Well, I mean, I think Jim said at the beginning, kind of, we've been, doing pandemic plans for 30 years. And every time there's a pandemic, there's a lot of excitement and push, and people put a lot of resources into it. A year later, everyone forgets about it, and it goes on the shelf, and it becomes, something that no one focuses on. So I think what we're going to see is an ongoing effort by at least the private sector to really put this high up the priority list. Over the last bunch of years, it's all been about terrorist attacks, cyber threats, civil unrest, political unrest. But now, pandemics and that is something we're going to be monitoring a lot more closely than we have in the past. And remember, we have, the coronavirus was a little off the beaten path. We were not considering that to be a pandemic virus. We were all looking at the flu. So we know the influenza, it's just a matter of time. It's not if, it's when. So we still have the pandemic flu to worry about. And we had Zika, we have all these things that also are influenced by global warming, mosquito-borne diseases, melting of the permafrost, new viruses and bacteria coming on board. So there's a lot of threats, and where I am, wildfires as well. So I think it's and I think companies have realized that they're going to have to do a lot of the work themselves. Governments don't have a lot of the bandwidth and infrastructure, and also their objective is the good of the community, right? And so it's not always aligned with the company's interests of particularly if you're a global company. So I think you're going to see a lot of companies put more energy and effort into this whole area, and I think with technology it can be a lot less painful. In the past, it was big thick binder that just sat on the shelf. Now it's a dynamic, software, functionality, which makes everyone's life a bit easier.
Well, my last question before we go into Q&A, I actually wanted to talk to you about technology. It's really the pandemic's really brought to light the need for health surveillance and tracking better what's going around, what's happening in the world. So this brings, of course, fears of Big Brother style monitoring, and also it brings hope for advantages that we will be able to get a handle on things earlier. So what do you know? What's happening? Are people innovating around this? I would assume so.
Oh yeah, I mean, I think if we look back again at this pandemic, there's never been any kind of time where we've had as much focus on one particular issue than this pandemic, right? Every scientist in the world trying to figure out either how to treat it, how to identify it, and how to mitigate it, right? All at the same time. But I think what we're looking at when it comes to data, though, is there's definitely a huge challenge of privacy. I wouldn't say challenge, but the right of privacy is very, very important. So anytime you're looking at data privacy is a major concern and a major key check mark that you've got to cover off on. So that means that a lot of this data is going to be, de-identified. You don't know who it is. It's large data sets, so you can't know, who those persons are that might have had whatever you're looking for. But that's on the personal health side. The other things that we're seeing, though, is that there are other types of indicators that are non-human. So there's wastewater. There's a lot of information around that you might predict what's going on through the wastewater. You can also look at the animal species. We know a lot of these viruses jump from animals to humans. So how do we better monitor them? So there's a lot of indicators that we can look at that don't implicate, our personal privacy. Travel patterns, all of that, because we know that these viruses, the only way they get there is a person has to go from A to B. These viruses don't have wings. They come, they go with us. So our travel patterns are going to be important. So all that data, and then understanding what's the normal trend of it, and then seeing what's an outlier against it. So if you see, wow, something's happening in Angola, and it's outside the norm, we investigate. So it's more of early warning systems that we can start to look at that we're talking about.
Okay, how fascinating. Well, we've got some questions cropping up here. I know people are anxious to ask, how safe do you expect the vaccines to be for kids under 10? We're now looking here in BC at vaccinating, I think, from 12 to 17. What does this look like under 10?
Yeah, look, I mean, I think the safety profile, particularly of the mRNA vaccines, has been excellent so far. I mean, we're talking millions and millions of people now taking it. The main concern with the mRNA is allergic reactions, but still very, very small. So I would suspect that it's going to be, very safe. And, that's, we've been somewhat really fortunate that this virus in particular has not impacted children, significantly. Of course, we've seen some unique reactions that certain kids had, but generally they haven't been significantly impacted. But the concern is that with these variants, they might be more adapted to kids. So we definitely want to get everybody vaccinated that we physically can.
Okay. And what about the idea of mixing vaccines? There's a study happening here right now, especially for those who got the AstraZeneca. Will doing a different vaccine boost for the effectiveness of the original?
Yes, exactly. Yes. Well, look, so the UK started some studies already. We've had lots of discussions with our global physicians group that we meet every week and have some of the world experts talk about it. I think the general consensus is that it will be safe. And not only that, we actually might find that it may be beneficial because each vaccine kind of stimulates our immune system somewhat differently. And so it might create a much more broad and effective immune response by having a different vaccine than the same vaccine twice. So that's I think potentially a potential benefit of getting the two. And we're going to see probably that it's going to be interesting to see what we do with the with booster shots that come on, whether, if you had Moderna, do you go get a Moderna booster shot, or is it better for you to get a Pfizer booster shot? All of those things, we have to see how it plays out. And again, this is where science is a bit lagging, but the general information coming out so far is it's good news.
Right. Okay. And somebody's asked here, can the analytics you mentioned be used, tested to see if you can reduce the spread of influenza type viruses?
Absolutely. So you might consider this whole concept of respiratory, airborne diseases, and there could be, there could be a lot of airborne disease we haven't even thought of that might come next. But the same methodology, is going to be put in play. It's you got to protect it coming into your airway. So how do we do that? Well, we got to have something in front of your face. So it's not really rocket science from that perspective. And so, respiratory protection, whether it's, absolutely influenza, coronavirus, other types of viruses that might come up in the future, if they're passed on by air, if they're floating in the air, that's how we protect ourselves. And I think we're going to find, hopefully, and I'm somewhat surprised we haven't really, come up with some creative solutions around the mask, because it's really was designed, for surgeons not to cough into someone's wound. It wasn't to protect the surgeon from getting sick from the patient. So, and you'll see, many years ago, it seems now, where a lot of people in Asia, you might see them on aircraft wearing masks. And it wasn't because they were afraid of getting sick. It was because they had a cough and they didn't want to pass it to others. So it was seen as a community, you're benefiting the community. And we still have that's still part of our culture now with the mask, is that it's a social good thing, right? It's more so you're protecting others from you than you from others. Again, there's a win-win there. But yeah, you're absolutely right. We're going to see probably better personal protective equipment come out. I saw some people with, some of these old, I don't know if you've seen the new swimming goggles, that cover your whole face, and they have a thing and you put a filter on it. People are coming up with all kinds of crazy stuff. But if it's protecting, a virus entering your airway, that's the way to go. One other interesting little tidbit too is that, viruses are killed by UV light. And they actually found and we've been killing viruses with UV light for years. Like all the hospitals, once you're out of the operating room, they put a special UV light that kills all the virus and bacteria in the room, but humans can't be in there because it's damaging to us. But they found a certain wavelength, 222 MVs, where it kills viruses, but it's safe for people. And so I think you're also probably going to see in a lot of, and we're already seeing it in some gyms, like Miami Dolphins football team has them in their gym. Certain restaurants in New York were putting them in, but you can now get lighting that's specific for this wavelength that will kill the virus, that's around that area. So we're going to find more creative ways to, to protect, and it doesn't just kill coronavirus, it kills flu virus as well, and all the others. So find creative ways of better protecting ourselves as well.
Okay, well, as much as there's been so much despair around this pandemic, doesn't it also give you hope in human ingenuity? And
Oh yeah, for sure. Look, we've been we're learning. I mean, the mRNA as a methodology for vaccine is just one small piece of this concept. You're going to see this become a treatment for all kinds of diseases that we could rapidly put in place. So this has really helped leapfrog a lot of our technology, a lot of the antibody research that we're doing, monoclonal antibodies, and how they've been really effective. So I think, this has been a really major jump for science, and we haven't even started to see a lot of the benefits yet, because it does take time.
Okay, I wanted to move for a minute to talk about vaccine passports or digital certificates. And also, I know some airlines are working on things like the AOK pass and whatnot. What do you think we'll see? Will we see a universally accepted digital certificate, or what do you know about this area?
Yeah, so it's a real moving target, and there's a group at the World Health Organization that's trying to create standards. And there's kind of two levels of standard. One is what's the data security of the app, right? So that you can store your personal health information with it being secure for you. And that technology exists today. They're using blockchain technology now, so you're not having to pass personal health information; it just stays on your phone. So that one is pretty clear. The real challenge with all these passports is certification and validation. How do I know that you went to a laboratory to get that test? How do I know that vaccine, little flimsy piece of paper is you? That's really the biggest challenge we have with these passports. And so what a lot of these passports are doing is they're really being used for testing right now. And you connect to the lab. The lab has an API, a way to pass the information to your phone. seamlessly. So you go to a lab, the lab does the results. It's automatic to your phone, so the individual doesn't have to do anything, but you have to connect the lab to be able to use the app. So that's the biggest challenge, because there's a lot of laboratories around the world, and then each authority needs to basically, agree that that laboratory is certified, that process meets our regulations, and so that's also what the governments are trying to work through. When it comes to vaccinations, this is going to be the trickier piece, particularly when in North America and in Europe, where millions of people have been vaccinated, and all they've gotten in most cases is a paper card, which can be copied and forged very easily. So I don't think anyone's really figured out, okay, how do we get that genie back in the box? Some governments are producing digital passports right off the bat, for their citizens. But there's a lot of politics in the US saying, with certain governors saying we will never have passports because it's Big Brother. So you've got this privacy, freedom kind of concerns. So I'm not certain exactly how. I think whether we're going to go the route of yellow fever, where you have to go to have to have a certified card, or it's going to be on some kind of very high level approval basis that, a Scout's honor, I got my shot, it's still unclear. Or there's going to be some kind of validating authority that you would go with your card. So you would go with your card, you would send them a picture of it, they would interview you, where did you get it? Which arm did you get it? What date did you get it? What did the nurse look like? All of those things to try to validate as best we can that it's not a forged certificate. But if you think about travel, vaccinations are becoming something that governments are looking very carefully at, that they want to know people are vaccinated. And in the US, and they've kind of flown the door, opened the doors and said, hey, if you're vaccinated, here's what you can do, but they're not saying how they're going to let people know whether they're vaccinated. So how are you going to know? So it's still unsolved.
I know there's been significant understanding and frustration about the Canada-US border, of course, because there are some people who have been heavily impacted by that, businesses, for instance, and really want to see it open. And then there's a lot of caution. And I don't know, do you think the Canadian government is going to move?
Yeah. So here's the thing. I mean, the thing about borders, it's almost counterintuitive, because you're going to see the most, probably, this is just a generality, but you're probably going to see the most aggressive border control in places with no or limited outbreaks, because no one wants anyone coming in, and destroying your pristine environment. So Australia is a good example, right? Australia's almost had no cases. They are militant about people coming to the country. You are locked in a room for 14 days. There's actually a policeman outside your door. You can't go out. 14 days, hotel room, locked up, testing, monitoring, the whole thing. So the reason for that is because, when we look at mitigating a pandemic, you want to contain it. The first objective is what we call containment. You want to circle it and make sure it can't get out of there, and which means you're aggressively contact tracing, you're quarantining, and you want to try to stop the fire before it spreads. Once the fire is out of the bag, there's not much you can do. It's now around just mitigating. It's trying to reduce the numbers by masks and social distancing, but travel now becomes less of an issue. It's already out of the bag, so why are we controlling the border now? If Canada is a worse outbreak now than the US, why are we stopping Americans from coming in? The Americans should be stopping the Canadians from coming in. It should be the other way around. So this is what's going to happen over time as we realize kind of, where these outbreaks are occurring. So places that have recovered and they're getting back to normal, they're going to have probably very tight restrictions. Places that have big outbreaks, they're probably not going to have as big restrictions, and it's going to change.
Okay, that's very interesting. I want to just shift topics because we've only got a few minutes left. We have a question. Can you elaborate on the relationship between climate change and pandemics?
Yeah, so climate change is going to typically cause a lot more weather related events. You're going to see a lot of drought in certain areas. You're going to see a lot more rain in certain areas, and you're going to see a rise in temperature. And when it comes to global health, a lot of those concerns are going to focus on what happens to flora and fauna. In particular, from a human's perspective, it's all the things that bite you in the night. So it's mosquito-borne diseases, but it's also waterborne diseases, things that get into the water sources. A lot of problems with standing water that can cause health issues, and also quality of water. If you get flooding, we saw that in Texas, right, where their water system was almost shut down with a storm. So all of these things can influence that type of activity. And then on the flip side, if you get into drought areas, you're talking about fires. And most people's, for California, our issue, unless you just happen to be up in the mountains, the issue really is smoke problems. So it's air quality issues, how air quality affects people's breathing and asthma and health related issues around that. So those are some of the more easily identifiable health issues, but it's and also just general raising of the temperatures affects the carbon that we're going to need to keep air conditioners running. So it's got a knock-on effect on overall carbon dioxide as well. So you're seeing a lot of these challenges, and the other piece too with drought. You might find farmland that used to be arable not anymore, and farmers moving into the cities and increasing density in cities. And we know that with density, you've got spread of disease a lot more easily as well. So as our population also comes into cities and to large communities, it puts us at risk as well. Because if we're more spread out, we're less risk of transmission.
Gives me anxiety thinking about it. It really does. And one thing a lot of people are talking about, and that's giving them some anxiety, is the future of work. Here's a question from one of our readers. What are your clients generally doing about going back to pre-COVID office work environments? Any unique approaches you've heard about? What does this look like?
Yeah, look, at SOS, we're dealing with the same issue. Everyone's dealing with the same issue. I think, there's not a universal answer. I think part of it has to do with the kind of business you're in, and the kind of work you do, how collaborative that work is, whether the work can be performed from home. I think one thing for certain is that business travel is going to be a very focused and targeted effort, and where in the old days we would just get on a plane and go see a client or a customer. Now there's a consideration of A, should I go there? B, does the client want to sit with me? And B, D, we're on Zoom. Is this as good as being there? So I think, and also you're seeing a lot of companies that had huge travel budgets now have zero travel budgets. And they're going to say, do I really want to spend all that money on having my people go there? I'm really going to get value for the travel. So I think travel is going to be, a slow process coming back. And that's part of our day work. And then in the workplace, we're seeing a lot of companies, I would say, look at redesigning their offices, so that it's more of a, you may not have your own desk anymore. It's a shared desk model, which is becoming more common. People can work from home, but they still need to come into the office maybe a couple days a week. And so therefore it's more of a home and office kind of setup, and to maximize use of that space. And also, try to cordon off some of those areas so that you don't have multiple people potentially being exposed to each other. So we're kind of continually thinking of that level of exposure. So it's definitely going to be a new world. And I think that for some companies, they might not come back to work significantly. Others, I know that one thing though is that and it's almost counterintuitive, particularly on the tech side. The young employees, a lot of the data coming back is they're desperate to come back to work. And we all thought, okay, all the techie kids, they're on their laptops, they can do it from anywhere. But no, they want the social interaction. They also are probably living in a lot tighter quarters where they don't even have a workspace to work out of. And with the tech companies, they want a free lunch, at the office. So all of those things play into getting people back to work. But also remember, we have a first world problem here of getting back to work. A lot of the other parts of the world, we're in different phases. So I think for global companies, they're looking at these guys are back to work, these guys are not. Each region in their own little island, is ultimately doing their own thing, but using the same standards.
That's really fascinating, and regardless of what happens with work anywhere, I think that you've given us all, well, you've given me a sense of confidence that there are a lot of people out there looking after this problem, and maybe a bit of hope about the future as well. Just before we end, I wasn't able to get to one question. I don't think we have time for it, but I want to mention that somebody has brought up UVic was doing wastewater surveillance. And they've been doing it since August 2020. And you did mention that is one of the things that you're going to be looking at.
Yep.
I just want to really thank you for being here. I mean, it's a fascinating discussion. Any final thoughts from you?
Yeah, no, look, I think we have to leave this on a positive note. I mean, this pandemic will be over. And if you think about, a century ago, the roaring 20s, right? And we don't have any kind of real vision of that except in some of the movies. But if you think about what happened back then, when they finally came out of that pandemic, there was this whole release of excitement that, hey, we can get back to living and enjoying life and all the rest of it. So I think that's around the corner for us, and I think we have to. It's going to come, and I think you're going to see a major rejuvenation in a lot of the things we do it smarter. I think you're going to see an explosion of science coming out of this that makes the world a safer place too. So I'm ultimately very positive about things. We still have another year of difficulty globally, but that might be different than our island where we are today. So I think we all should be positive about the next steps.
That's great. Well, thank you so much for being with us. And your time is you're a very busy guy, and we're very lucky to have you here. Jim, thank you for your wonderful introduction, Jim Hayhurst. And I just want to mention, thank you to our members at South Island Prosperity Partnership, and stay tuned for news on more ideas and impact coming up. Thanks, Myles. Have a good day, everyone.
Great. Thanks, everybody.